You heard common cold a lot. What exactly is this disease? In this video we're going to talk about what exactly is common cold and causes, how do you get common cold, how do I prevent myself from catching cold, symptoms of common cold, when you better see a doctor, simple and effective home remedies for common cold. The common cold, also known as an upper respiratory tract infection, is a viral infection primarily caused by rhinoviruses. Other viruses, such as coronaviruses and adenoviruses, can also contribute to the onset of the common cold. The symptoms of a cold typically include a runny or stuffy nose, sneezing, coughing, sore throat, and sometimes a mild fever. While the common cold is generally a mild and self-limiting illness, it can be a source of discomfort and inconvenience. Transmission. The common cold is highly contagious and is primarily spread through respiratory droplets produced when an infected person talks, coughs, or sneezes. Additionally, the virus can be spread by touching a surface or object with the virus on it and then touching the face, especially the nose, mouth, or eyes. Prevention. 1. Hand hygiene. Regular hand washing with soap and water helps prevent the spread of the virus. 2. Avoiding touching face. Refraining from touching the face, especially the nose, mouth, and eyes, reduces the risk of virus transmission. 3. Respiratory etiquette. Covering the mouth and nose when coughing or sneezing with a tissue or elbow helps prevent the spread of respiratory droplets. Symptoms. 1. Runny or stuffy nose. The inflammation of the nasal passages results in a runny or congested nose. 2. Sneezing. Irritation of the nasal passages triggers frequent sneezing to expel the virus. 3. Coughing. A dry or productive cough may develop as a response to irritation in the throat and airways. 4. Sore throat. The throat may become sore or scratchy due to viral infection. 5. Fatigue. Mild fatigue or weakness is common as the body fights off the infection. 6. Mild fever. Some individuals may experience a slight increase in body temperature. Duration. The symptoms of a common cold typically appear 1 to 3 days after exposure to the virus and can last for about a week. While the majority of people recover without complications, certain populations, such as infants, elderly individuals, and those with weakened immune systems, may be at a higher risk of developing more severe symptoms or complications. When to see doctor. In most cases, a common cold is a self-limiting viral infection that does not require medical attention. However, there are certain situations in which it is advisable to consult a healthcare professional. Here are some guidelines on when to see a doctor if you have a common cold. 1. Persistent or severe symptoms. If your symptoms are unusually severe or persistent, it's a good idea to seek medical advice. Severe symptoms may include high fever, persistent cough, severe headache, or significant fatigue. 2. Complications. If you develop complications such as a secondary bacterial infection like a sinus infection, or bronchitis, it's important to see a doctor. Symptoms of a secondary infection may include worsening or prolonged symptoms, increased shortness of breath, or the development of green or yellow mucus. 3. Underlying health conditions. If you have underlying health conditions such as asthma, chronic obstructive pulmonary disease, or a weakened immune system, you should consult a healthcare professional. These conditions can make you more susceptible to complications from respiratory infections. 4. Fever in infants. If an infant under 3 months of age develops a fever, it's crucial to seek medical attention promptly. Infants in this age group are more vulnerable to serious infections. 5. Worsening symptoms. If your symptoms initially improve but then worsen after a few days, it's advisable to see a doctor. This could be a sign of a secondary infection or a different respiratory illness. 6. Persistent ear pain or discharge. If you experience persistent ear pain or discharge, it may indicate an ear infection, which may require medical attention. Treatment. 1. Rest. Adequate rest helps the body divert energy toward fighting the virus. 2. Hydration. Drinking plenty of fluids helps soothe a sore throat and prevents dehydration. 3. Over-the-counter medications, pain relievers, decongestants, and cough suppressants can alleviate symptoms, but they do not cure the cold. 4. Humidification. Using a humidifier can add moisture to the air, easing nasal congestion and throat discomfort. Conclusion. While the common cold is typically a minor illness, its impact on individuals and communities can be significant due to its widespread nature. Practicing good hygiene and adopting preventive measures are crucial in minimizing the risk of infection and limiting the spread of the common cold.